Thank you, Kevin. And I'll start going a little bit off track, and then we'll get back on. But Hatito Chakiwiesa, Nite Sito Steve Roach, Sawanwaki Nila, Sekamika, Sawanwaki, Lenawawewi, Yahweh. So I just wanted to start out by saying, and giving an acknowledgement to the people that actually lived in this area before the white settlers came here. So in every part of this country, there were actually people that lived here before. And actually, one of my ancestors was a Shawnee person that actually fought to defend this country, this area. And so we're coming up on Indigenous Peoples Month next month. And I just think it's wherever we are in the United States, we're actually on land that was the territory of indigenous people. So one of the tribes that was here in this area was the Shawnee. Another one were Cherokee. Miami were here. Delaware were here. Wyandots and the Senecas. And I'm probably missing some folks too. But I just wanted to start out of that. And for me, this is very important for me to be here and also to speak the Shawnee language, because that was the language of the people that actually lived here in the past for thousands of years. So having done that introduction, let's get on to my topic here, which is about antibiotic-resistant bacteria in agriculture. The work I do is on looking at the results of how agriculture affects human health. And one of the big issues we did discuss is antibiotic resistance, because it's a really clear example of something you do on farm using antibiotics having a direct impact on human health, which is through the transfer of antibiotic-resistant bacteria. But because it's a really big issue that we're trying to deal with, and we're kind of, I guess, working against sort of the agriculture industry and the pharmaceutical industry, which are very powerful. So I work with the Keep Antibiotics Working Coalition, and that's 16 advocacy groups, and you can see them all up there. We kind of come together, and in this coalition, we mainly just work on antibiotic use in agriculture. Okay, so one thing I like to, when I'm talking about antibiotics, they're new, really. My father was born in 1933. When he was born, we really didn't have antibiotics that anyone could be treated with. So it's actually in one lifetime. We've only had antibiotics for one lifetime. My father is still alive, and he's had several cases, particularly in the last couple of years as he's gotten older, where he's really dependent on antibiotics to still keep being alive. But the problem is when you use antibiotics, you're selecting for resistant bacteria, and I'll talk about that a little bit before. So what we're, in one lifetime, my father's lifetime, we've gone to where we have these miracle drugs that can allow people to survive. They have not many side effects, though we're actually learning they do have a lot more side effects than we kind of thought probably 10 years ago. But now we're actually coming down to the end, because what used to happen was if one antibiotic didn't work, you'd switch to the next one, and then we'd switch to the next one. But right now we're getting to the point where there are people that are just dying because the bacteria they're resistant to 20 antibiotics. So there's nothing left that will actually work. And so this is what we call a post-antibiotic era. So what is antibiotic resistance? I'm not sure how much you guys knows, but I just figure it's good to start out with. So basically what happens, you start with a population of bacteria in an animal, because I work on the animal side, so these are pigs. And then you give them an antibiotic. They may have an infection. In animals, we often give animals antibiotics, not when they're sick, but in anticipation of potential sickness. And we used to give a lot just to make them grow faster. It's something that nobody really understood, but they knew it worked. So to give them antibiotics, it'd make them grow faster with less feed. But when you do that, what you do is you kill off the susceptible bacteria, and you end up with the red one, which is the antibiotic-resistant ones. So you have, at that point, you have less bacteria of the target bacteria in the animal. But then it survives and it multiplies. You keep feeding them antibiotics, and you shift the population to that to where there's a large number of them are resistant. And then at that point, even if you take the antibiotic away, then a lot of times the resistance will stick around. And you can do this with multiple drugs, and that's what we've done. We've gone from one drug and we switched to new ones. And on On the left side of the screen, it just talks about some of the ways that that resistance, which is selected for in animals, can be spread around. And so we give antibiotics to ourselves, and it gets into our guts, and sometimes it makes us sick, or sometimes we transfer the same thing. The same thing happens with animals. We feed antibiotics to animals, or we give them antibiotics in the water, which is the main ways that we're using them. And then the animals excrete a lot of those antibiotics out, so in their environment, they select for resistance there. And then we slaughter those animals and take them and put them in a grocery store and take them to our home. And so often if you look on the, and I have a couple slides about the percent of multi-drug resistance on meats, if you look at on pieces of meat, you're going to find a lot of resistant bacteria on them. And the other way the antibiotic resistant bacteria doesn't just go on the meats, it goes out in the environment, so it can pollute our water. Antibiotic resistance can also be detected in dust from farms. I know there was one study where somebody actually followed, if you've ever seen a pig truck or a cattle truck driving down the road, you can actually detect resistant bacteria in the dust coming out of that as you're driving down the road. Now, what is the impact of that? It's hard to tell, but the resistant bacteria will be there. The food is probably the easiest one to see. So antibiotic resistance, basically, as I said, it's bacteria that have become resistant, so the treatment that used to work no longer works. So again, because I work on food animals, the treatments we used to use for things like salmonella infections, serious salmonella infections, or campylobacter infections were tetracyclines and penicillins. Generally, if you get a serious campylobacter or a salmonella infection, the doctor is going to start you on fluoroquinolones or cephalosporins. They're not going to start you on ampicillin, even though it'd be bad, if it's not resistant, really what you want to take is ampicillin. And hopefully if they do a susceptibility test, and when they find that it's susceptible, that they'll switch you back from those newer drugs into the older ones. So this is just a thing about a turkey-linked salmonella outbreak. 164 cases, and there was a lot of resistance in there and I'm trying to remember this case. There's, this one's a little bit older, and there's been some new ones, but a lot of these were resistant, probably resistant to some cephalosporins, definitely for ampicillin, and then a bunch of other drugs. For a long time, we used a number from 2013 of 23,000 deaths in the United States from resistant infections. And again, these come from hospital use, human use. Whenever you use antibiotic, you're going to get resistance. So hospital use contributes to it, outpatient doctor use, but also the animal side. So we used to talk a lot about 23,000 deaths a year. But these guys were looking at that, and I've talked to infectious disease doctors, and they were saying that number is just way too low. And so this is another calculation, and they found around 160,000 people are potentially dying each year from resistant infections. Where we are out now, and you have to think is right now, the worst resistance, which are to polymyxins and carbapenems, is still quite rare. But we're still having a lot of deaths. And maybe an antibiotic can treat these infections, but if you don't get the treatment started at the beginning, then you're more likely to die and get more seriously ill. So how are antibiotics used? So as I was talking before, the way you get antibiotic resistance is by using antibiotics. So what that means is we really need to limit antibiotic use to where they're absolutely necessary. So you want to use the least amount possible. And if you look at it in the United States, and this is 2017 data that we have from FDA, is that 63% of the sales of medically important antibiotics, those are the ones that are in the same classes, so they're related to the drugs used in humans. Of those go into animals. So, and it's mainly in food and water. If you look on the left-hand side of the slide, it kind of breaks it out. So the blue one is, I'm trying to see, okay, so the humans is a blue one, the orange one is animal feed, and the gray one is animal water, and then there's some other routes in animals. So it's mainly in food and water, but there is a good bit of injectable antibiotics. Food and water makes sense for animals because you have big pens. You don't, it's really hard to go and inject each one, or it's also, giving each one a pill is very difficult, except at certain points where you're handling them. Right after they're born, you can do that. So and the main drugs are by volume, the main drugs are tetracyclines, penicillins, macrolides, aminoglycosides. So, and what are they used for? So cattle, the sales of antibiotics in animals, the highest amounts are going into cattle. So 42% of the food animal sales, so if we look at that, take out the section for the humans, 42% of the food animal sales are going into cattle. Use is significantly higher in our U.S. cattle population. If you divide the amount of drugs for the cattle population, the amount of drugs for cattle by the weight of the cattle, then you can kind of calculate and compare across countries. So it's a crude estimate. All of these, talking about the whole amounts is crude. But we do use significantly higher amounts per pound to produce cattle in the U.S. than in UK, France, Netherlands, or Denmark. And a large part of that is chlortetracycline for respiratory disease and tylosin for liver abscesses. So, and again, from my organization's perspective, a lot of this use is related to how we raise the animals. So the tylosin, which almost all the feedlot cattle are getting now, you give them to address diseases caused by, or a problem caused by giving them diets that are high in starches. And so and we're giving tylosin, which is a very important antibiotic. You could, so it's related to azithromycin or erythromycin. And the last one that you use is ionophores. So if you look at the chart on the left, it kind of, on the, let me see, the right-hand side, you have the drugs, and then on the left-hand side, you have the reasons for use. And this is similar, a similar graph for swine. 36% of the food animal use went into swine. Again, we use a lot more antibiotics to produce swine in our country than in some of the other countries, France, Netherlands, Denmark. The biggest one that we're using of the medically important is chlortetracycline and thiamulin. Chlortetracycline, everyone knows. Thiamulin is related to I'm having trouble remembering the human drug, but it's a drug that was just approved for community-acquired pneumonia, and it's a topical as well. So, and then the other one they actually use a bunch for diarrhea in pigs is carbadox, and that's a carcinogen, and FDA in 2016 began withdrawing it because they found residues of it in the liver of pigs that had been administered it. And the problem with that is the drug companies fighting them, so they haven't been able to withdraw it. So it's still used, and it's used in over half the pigs in the country. So, and poultry is our good news story. So chicken is only 5% of those sales of antibiotics for use. And we produce more chicken than anything else, except cattle, but we produce a ton of chicken. Turkey is a bit higher, and we don't produce very much turkey. So they're actually, per pound of meat, the turkey use a lot of drugs. And that's compared to other countries. But chicken, we're good. I mean, chicken consumption is low, and it's gone down recently. And I'm not sure if this slide or somewhere I could bring it up, but 92% of the chicken in the United States are raised in programs that have reduced antibiotic use. Either they don't use any medically important antibiotics, or they only use medically important antibiotics, or antibiotics that aren't medically important. So they use some of the ionophores. And I think a lot of that, we take a lot of credit for that because we put pressure on the fast food chains, and then they put pressure on Tyson and Purdue. And really in the mid of the 2000s, they started changing over. But it's just been in the last year we've seen really drastic reductions in use in chicken industry. So what is the result of all this antibiotic use? We only have data up to 2015, and this is for the National Antimicrobial Resistance Monitoring System. It's a federal program that goes out and samples in animals at slaughter, retail meat from the grocery store, and then CDC provides data from sick patients. But we only have data up to 2015. I put on here data from retail meat. So this is, and what I was looking at, a good indicator of antibiotic resistance is just multi-drug resistance. So this is E. coli on the meat that's resistant to more than 3. And at the top one's turkey. And you can see, over like 40% of the turkey, E. coli on turkey has multi-drug resistance. And then chickens, somewhere in the middle, and then cattle and pigs are better down below. And part of that's just the way we treat cattle. You take their hide off, so they have less bacteria. And for whatever reason, they tend to be lower. But we haven't seen, I think it'd be really interesting when we get new data. Hopefully the chicken ones have gone down since they pulled out a lot of the antibiotics in the last couple of years. And the drugs that CDC would say are the worst, most troubling ones. And again, we're kind of only worried about, we only use carbapenems because we already have a bunch of other resistance. Same thing with polymyxins. You'd never go to them first. But we have found resistance to polymyxins, the last resort drugs, and carbapenems in food animals in the U.S. Linezolid's another one for gram-positives and resistant to vancomycin. But at this point in the U.S., they're very low. There's some other countries where polymyxin resistant and CREs are very common. So if you go to China, make sure your meat's cooked well because there are fairly high levels of polymyxins and CREs in every piece of meat. So what can we do about it? So the Food and Drug Administration is the branch of the government that has regulatory authority over drugs, animal drugs and human drugs. And basically the criteria that to get a drug approved in the U.S., it needs to be safe and effective. So the drug maker has to provide data showing that they're safe and effective before it can go marketed on sale. You would have to do studies showing safety and efficacy. Where food animals are a little bit different, there's another piece of it that you have to show that it also doesn't create a food safety problem. And the main two things we're looking at is residues and then whether it creates antibiotic-resistant bacteria. When the drugs are approved, you have a label indication. It says what you can use it for, and this is the same in humans. One different is for drugs used in food animals, ones that you put in the feed, you can only use it as a labeled indication. There's no extra label use in animal feeds. Since 2003, any new antimicrobials for use in food animals require a risk assessment. So FDA has to actually, the company has to do some steps to show that it's not going to cause a high risk of resistance. So these are some of the things they've done. The risk assessment started in 2003. They banned a class of drugs, fluoroquinolones, for use in poultry in 2005 because of concerns about resistance going up in poultry. 2008, Congress requires FDA to collect data on the amount of sales. In 2012, they put restrictions on how you could use cephalosporins, again, a drug that you would use to treat infections you get from animals. In 2017, there was a ban on growth promoters. So now you can't just give animals medically important antibiotics to make them grow faster and with less feed. And we also required for feed and water drugs a veterinary order to do that. Now, a vet can give an order that's useful for 5 months for multiple animals and multiple farms, but at least the vet's in the picture somewhere. And in 2018, they came out with a 5-year plan. So the 5-year plan, I'm just checking all my time, will move all of the additional medically important antibiotics to prescription only. So that's a good thing. It'll update the list of medically important. And another thing that we're concerned about, some drugs in animals you could use for the whole life of the animals. There's no limit on the duration. And FDA does want to require some limited duration on all drugs. And then improve collection of data on use and on resistant bacteria. So, so that's a good plan. We support all of those things. I think they're all great things, but we're also worried that they won't go enough. If you look at the figure on the right, it basically, the red line at the top and then the other yellowish line, I think that's yellow, are basically the amount of sales of antibiotics in the U.S. per pound of animal meat. And you can show we're kind of on the high end. We're not as bad as Cyprus, Spain, and Italy, for whatever reason. Don't always believe that Europe is great in everything because it varies. But we're much worse than a lot of the places like Norway, Sweden. The Scandinavians tend to be really good on not using too much antibiotics in humans, and they're also good in animals. So we think there's a lot more we can do in the U.S. And so that's what our kind of, so in 2017, the World Health Organization made recommendations on how we should be using antibiotics in animals. So they said there should be an overall reduction in use of medically important antibiotics. And then they started ranking things by how important the drugs were for humans. So they said, eliminate the use of medically important antibiotics for growth promotion. We've done that in the U.S., so that's a good thing. But we still have like 3 other things down the way that we haven't done. And probably the one that we're most concerned about is eliminating the use for disease prevention. So in animals, you often use antibiotics for, not on sick animals, there's no signs of illness. You just do it because you anticipate at this point in their life that they're going to have a problem. And we think that's a bad way to use something as valuable as antibiotics. And then there are also some rules. They say some of the most important drugs you probably shouldn't use in animals. I would agree polymyxins should not be used in animals. A last resort drug in humans shouldn't be used in animals. So one of the things we're arguing is asking the FDA to set targets for reductions. And looking at other countries, we can see there's room for improvement. Eliminating the routine use, that's been our kind of what we've been calling out for years. Prevent disease in animals through improving management, not through just routinely giving drugs. And I think that's the main thing we're there, and also that setting durations. But we don't say just set any duration. So 4 weeks is probably too long for most antibiotics. So we're saying 3 weeks, no more than 3 weeks. If you need to use an antibiotic more than 3 weeks, go back to the vet and see if you really need to use it. Try to figure out what you were doing wrong, why you need this continuous use of antibiotics. And then this is address the most important antibiotics, kind of like don't use polymyxins in animals, and we probably need to restrict further how we use fluoroquinolones and cephalosporins. And I'll always improve surveillance, reporting. I mean, you know, we keep doing that, but you know, at some point we need to do more than just looking at problems too. And I'm going to skip the research ones, but basically find ways to raise animals, better ways to raise animals without using so many antibiotics, and to manage disease without antibiotics. Okay, so the other part of my topic, the other area where we have a overuse that we see and that is neglected is the over-the-counter antibiotics in humans. And the one we're particularly concerned about is polymyxins, because again, it's a drug of last resort. You only use it systematically when somebody's going to die if you don't use it, because it tends to be fairly toxic, at least when it's used systematically. But any drugstore, probably any grocery store in the country, you can go and pull a tube of it off the shelf. The triple antibiotic ointment, that is, everyone probably, most of you guys probably have them in your medicine cabinet. That you get a scratch, you put some stuff on it. That probably has a last resort drug in it. It just doesn't make sense. And FDA is moving all medically important antibiotics to over-the-counter in animals, but we still have this crazy use of polymyxins in humans. So let's see. This is just a little bit about the drug. The World Health Organization calls it a reserve group antibiotics. Should only be used in specific settings where other antibiotics would not work. In 2015, we first found transmissible polymyxin resistance. It actually came from the food animal use, so they were feeding lots of polymyxins to cattle. And now it's all over the world. And the map there shows where we found it in the US. The orange ones are where it has been found in humans. The yellows were in animals in the US. CDC says polymyxin resistance is one of the two worst. The other one is CRAs, carbapenem resistance. And so, but in contrast, anyone, you all could, as long as you follow this monograph that was created in 1987, you can start manufacturing and selling polymyxin ointments. At the time they approved it in 1987, people weren't really using very many polymyxins because they tend to be a very toxic drug. And they didn't, when they approved the drug, they didn't require them to show that there was more efficacy by adding this one into it. I mean, most of the skin infections you're going to get are gram-positive. They're outside of the spectrum of this drug. So finally, if you look at it, CDC, you look at their latest standards on wound treatment, they don't mention using antibiotic creams on wound treatments. You clean it and cover it. I mean, if you get an infection, then you probably take oral or injection antibiotics. So they select for resistance. They disrupt the normal skin flora. And a sad thing is there is also some potential cross-resistance with bacitracin, which is another one of the ingredients in the triple antibiotic ointment. So in February 2019, we got together a group of 155 health professionals and asked FDA to remove the over-the-counter status of polymyxins. 5 months or whatever, 4 months later, they came back in a letter and said, oh, they won't take action without a formal petition. And I don't know if any of you guys have ever petitioned the FDA. they'll respond. They're required to respond to you like in 60 days. They do say, we're studying the issue. And then it could be, so then you have to wait another 3 years before you can sue them for delay in not actually responding to the petition. So it's not a very good way to get anything done. We're trying to think of other things to do on this one, just because it seems so dumb. There's probably potential for a consumer campaign, but it's kind of weird. Who's working on over-the-counter antibiotics? I'm Food Animal Concerns Trust. It's not my thing, but we've done it because we think it's so important. So that's my whole talk, and this is from the other side of my organization. We give grants to small farms. So these are some of the farms that we've provided grants to move the animals outside. And when you raise them this way, you also don't need to use very many antibiotics. So thank you all, everyone.